Okay, well, thank you again for everybody who's joining us. I think we'll begin. I want to start by saying welcome for joining us to the Alberta Federation of the Labor's fifth webinar in our Lunch and Learn series. And I'm going to take a minute to begin with our land acknowledgement. The Alberta Federation of Labor respectfully acknowledges that we are located on Treaty 6 territory in central Alberta, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. Treaty 7 territory in southern Alberta, the traditional territories of the Blackfoot Nation, Siksika, Kainai, Kainai, and the Tsuut'ina, and the Stoney Nakoda First Nations, including Chiniki, Bearspaw, and Wesley First Nations, as well as the Métis Nations of Alberta Region 3. Treaty 8 territory in northern Alberta, a traditional meeting ground for many Indigenous peoples. The territory provided a traveling route and home to the Cree, Dene, Inuit, as well as the Métis and many others. We recognize the history of oppression of First Nations, Métis, Inuit, and all Indigenous peoples in their traditional land across Canada, and we are committed to doing the ongoing active work of reconciliation. The Alberta Federation of Labor also recognizes that we are all treaty people with treaty obligations, and we are committed to living in accordance with the spirit of intent of peace and friendship that is foundational to the treaty relationship. As a labor movement, we will actively work together in solidarity to end oppression and seek justice for all peoples of this land. So thanks again for joining. And today our topic is about expanding the Medicare umbrella. I'd like to begin with a few opening comments. And to begin with, I'll say that the notion of Medicare really began in Canada almost a century ago, when the citizens and government realized that it wasn't enough to simply rely on caring and kindness from others. We needed more, and Canadians needed the security of knowing that they could access care when required without the very real fear of not being able to afford it. But this would all take time. And the first province to achieve a public health insurance plan was Saskatchewan, led of course by Tommy Douglas in 1962. But even in the infancy of Medicare, there were those who opposed the initiative. But the movement persevered, and Medicare has become an important part of our national identity and security. To be sure, the current healthcare system is under immense pressure, and there's those who seek to capitalize on the challenges that we're facing. They want to use it as justification to further erode our healthcare system and use that as so-called evidence that the publicly funded and publicly delivered healthcare system simply doesn't work. If the last few years have proven to be very difficult for many, and it should be self-evident that when we need it the most due to illness, job loss, or any other unfortunate set of circumstances, our safety net should be strengthened and expanded. Seeking to profit off illness and the care of those in need seems particularly cold-hearted, and using public money to fund private initiatives feels like a betrayal of trust. Indeed, Medicare was a system worth fighting for a century ago, and it's critical that we continue to defend and expand Medicare today. And so we're very fortunate to be joined by two individuals who spend a great deal of time and effort doing just that. I'd like to introduce Pauline Worsford, who is the elected Secretary-Treasurer for the Canadian Federation of Nurses Union, which represents close to 200,000 nurses across Canada. She graduated from the University of Alberta Hospital School of Nursing in 1981 and is a proud registered nurse. And she works with the staff. She works as a staff nurse, in the post-anesthetic care unit at the University Hospital of Edmonton. She's also part of the Canadian Association of Medical Teams abroad and travels to Quito, Ecuador every year on an orthopedic medical mission. In addition, Pauline is also the chair of the Canadian Health Coalition. We also have Chris Gallaway joining us today. Chris is an experienced community organizer and an advocate for public health care. Born and raised on a farm in rural Saskatchewan, he has since spent most of his adult life living on Treaty 6 territory, first in Saskatoon, and then for the last decade living here in Edmonton. His past experiences include working for the Alberta Federation of Labor, in 3 provincial legislative assemblies, and for a variety of nonprofit community organizations. And currently, Chris is the Executive Director of Friends of Medicare. Most recently, both Pauline and Chris were recognized for their impressive work and contributions, and they were awarded the Queen Elizabeth II Jubilee or Platinum Jubilee Medal. That's a mouthful, but you both deserve it. And so we'll start the conversation with a few opening remarks from each of the guests, followed by a few questions from me, and then we'll open it up to questions from all of you. And so please feel free to use the question and answer function to post your questions for our guests today. So we'll start with Pauline with a few opening remarks, if you would, please.
Certainly. Thank you, Karen, and thank you for the Alberta Federation of Labour for hosting this webinar for everyone today. I am still a staff nurse in the post-anesthetic care unit, PACU, at the University of Alberta Hospital. I just got off nights this morning at 7. So sometimes if there's a little glitch in when I'm speaking, it's because I've only had about 3 hours sleep. We had a busy night last night. So all that to say, I'm here in my capacity as the Canadian Health Coalition board chair. And the Canadian Health Coalition is a group of like-minded people made up, and the board is made up of labor unions, community groups, students, and interested individuals. We have a couple of doctors, and we have an economist. We have retired union activists as well. And we have a mighty team of 3 of our staff that keeps us a well-oiled machine at the Canadian Health Coalition. So shout out to them if they're watching. I very much appreciate all their time and talent that they share with the Canadian Health Coalition. It's been around, the Health Coalition has been around since 1979. And in fact, Tommy Douglas made a reference to the Canadian Health Coalition being the watchdog for Medicare when in one of his speeches in the House of Commons. And so we have been around since then, and we are the watchdog, there's no doubt about it, in collaboration with the other health coalitions across the country, and of which, of course, Chris is one. We have them in the territories and all the provinces across the country. And on our board, we have 3 seats for the provincial territorial health coalitions so that they are able to participate right at our board level to decisions and campaigns and that sort of thing. So that's kind of going to be my opening. We are the watchdog, and we will continue to be the watchdog. And we see this time right now as a huge opportunity to expand Medicare.
Okay, thanks, Pauline. I'll turn it over to Chris for his opening remarks.
Great, thank you, Karen and Pauline. Similar to the Canadian Health Coalition, Friends of Medicare, we are a nonprofit advocacy organization fighting for Medicare. As people know, Medicare is both a national and provincial government involvement in it. And for us, I think we see there's this great opportunity right now in healthcare where we could expand dental care, pharmacare. There's some opportunities before us, but also that threat that Karen mentioned, that there are those seeking to capitalize on the struggles we're seeing in the system to really push this agenda of privatization. So we're kind of having both of those things happen at the same time right now, where there's some serious threats, probably the biggest threats we've seen to the system in a long time. At the same time, there's this great opportunity to look at how we expand that Medicare umbrella to finally achieve that dream Tommy Douglas had, which always intended to include things like dental and pharmacare and seniors care and those pieces. It was never meant to be this separate siloed thing. So yeah, we at Friends of Medicare, we've also been around since 1979. We're a similar kind of coalition of unions and society groups and seniors groups and others. And we work closely with the other coalitions because this is a national Medicare system and we need to protect and expand it. But I'll leave it at that so we can get into the questions.
Great. Okay, thanks. So I do have questions sort of divided up for each guest, but if once I direct the question to one guest, please feel free for the other to make any comments you wish to make on that. We're pretty easygoing on during our lunch and learn sessions, but I am going to start with Pauline. I was wondering, Pauline, if you could please explain how the confidence and supply agreement could expand our public healthcare system And what areas, what are the biggest areas of opportunity that should be focused on right now?
So the confidence and supply agreement is the agreement between the NDP and the Liberals at the federal level. And so they came to this agreement to basically keep the Liberals in power because they are in a minority. So when you think about it, if you're in a minority, you need other people to support you in your whatever your piece of legislation that you're going to pass. So the NDP has agreed to participate in supporting Liberals, as well as the Liberals have agreed to support NDP when they put forward legislation. Case in point right now is the dental care bill that's being debated in the House. And so it really truly is the most opportune time right now, while we have that confidence and supply agreement, CASA for our slang, you know, we always like to put acronyms on things. So it's really truly our moment to put forward what we want as civil society, what we want Medicare to look like. So the Canadian Health Coalition has launched a Health and Hope campaign, because every story that you hear is negative, albeit you do hear some positive ones about healthcare right now, but the majority are negative. Long wait times, overcapacity, long emergency waits, long, doctors lists to get in to have surgery done. So we think that health and hope, we're talking hope. And now is the time to expand the public health system to make sure that it looks more like Tommy Douglas's vision. So I touched on health, dental care. So the pillars of the Health and Hope campaign are public dental care for everyone, a universal pharmacare plan, which is a public drug plan for everyone living in Canada, frontline healthcare investments. So we're not just talking dollars, we're talking investments of dollars, but they have to have accountability mechanisms. The federal government can't just willy-nilly give millions of dollars to the provinces and the provinces promise that they will spend it on healthcare or education of healthcare workers, creating more seats, whatever. We can't just, we have to have accountability mechanisms. That's a non-starter. Safe long-term care. So put in a piece of legislation that protects people who are in long-term care, because we see what's gone on with COVID in the private for-profit long-term care facilities. And then last but not least, pushback on privatization. We can't, I know the profiteers are just wringing their hands with glee in the sidelines, hoping that, the complaints about the wait times, et cetera, will be able to open up a plethora of for-profit clinics to do these surgeries. But we all know, all we have to do is look to our southern neighbors to see how healthcare based on profit is just not right. Because guess what? Profit doesn't care. Profit doesn't care.
Mm-hmm. So Pauline, before I give Chris a chance to answer that question, just to talk about the push for privatization, could you just sort of explain in simple terms, a lot of people might believe that actually opening up private clinics helps reduce the load on the public system, but what are your thoughts on that?
Well, that's a myth that it lessens the load in the public healthcare system, because right now, where would they get the staff? This is what I want to know. I was reading a memo last night that said, oh, great, we've added 150 ICU beds to the mix in the province of Alberta. Well, that's nice, but a bed is just a bed unless you have staff. You have to have staff. You have to have a registered nurse. You have to have licensed practical nurses. You have to have lab techs and x-ray techs and respiratory therapists. And I could go on. You have to have unit clerks. You have to have porters. You have to have housekeeping. A bed is just a piece of furniture unless you're going to have staff to support it. And that's why the for-profit clinics are a myth. They're going to skim the young, healthy people off the list. And they're going to leave the sick and frail and elderly for the public system to take care of. And it's just going to rob capacity in the public system. For-profit private clinics doing surgery to lessen the load in the public system is a myth.
Great, thank you for that explanation. Just give Chris a chance to talk about the confidence and supply agreement, if you have any words to say, and then we'll move on to the next question.
Yeah, and just on what Pauline was just saying, opening up a private surgical center doesn't create another doctor and more nurses, it just moves them out of the public system. And we've seen that in jurisdictions, including next door in Saskatchewan. Here in Alberta, we're modeling our surgical initiative off of Saskatchewan's, and Saskatchewan's wait lists are longer than they've ever been. And they're talking about sending patients to Alberta to try to deal with their wait lists now. All they did was use public money to create more private surgeries in the province that people are profiting off of. They didn't actually deal with wait lists or capacity. So we have a real life example next door to Alberta on that. In terms of the confidence and supply, maybe this is a good chance to talk about, in terms of dental care and pharmacare, especially pharmacare, the confidence and supply agreement's a huge opportunity, but it still takes the provincial governments to do it, as we saw with childcare and the need for them to actually agree to participate in the program and do it. And that's why, along with the Canadian Health Coalition, we've been calling for those strings to be attached. We have our premiers, especially here in the West, calling for more money from Ottawa for healthcare very loudly and regularly. Every time they meet, they're saying more money and they don't want strings attached. And our stance is, of course, we need some sort of new health accord, some sort of new health deal where the federal government steps up. But then those premiers can't keep saying they won't sign on to pharmacare if it happens, which is what our former premier said regularly. So to us, it's like, okay, let's talk about how we fund healthcare, but also you have to use the money you're getting for healthcare. You have to join these programs that are happening. You can't take $4 billion of COVID money and then refuse to tell Albertans how you spent it. That's not on. So there is that provincial federal relationship that, the confidence and supply agreement is very exciting. And we also need to make sure the federal government is very strong in how they implement it, ensure that there's strings, and we need to pressure our provincial governments to get on board. And I don't know if this is the time to talk about kind of the politics of what's happening in Alberta and our current, the gaps we're experiencing, if you want me to.
Sure.
I was actually watching debate the other night on the dental care bill in the House of Commons, and multiple Conservative MPs from Alberta got up to say, including the member from Peace River Westlock, to say that every child in Alberta already has access to dental care if they need it. The provincial government's great and they're providing it. And that's just simply untrue, right? They're just saying falsehoods, and coming from people who have publicly funded dental care for their children as MPs, saying, don't worry, everyone has it. In Alberta, we know that, we don't have an exact number right now, there's not current numbers, but about 1 in 3 people don't have employer benefits in this province. So they have to rely on other programs or have no coverage at all for things like dental or pharmacare. We also know as a province, we experience booms and busts. We saw after the 2015 crash of oil, that relying on people to have benefits through their employer is not a stable way to ensure people have pharmacare and dental care. Their employment changes, they lost their jobs, suddenly you're not covered, there's gaps. Each plan covers different things at different amounts. And the same is true for those who have to rely on the public provincial plans. There's a low income plan with a very low income threshold. There's, if you're on AISH or different things, you might qualify for a plan. There's co-pays with a lot of those plans. There's barriers. So there's huge gaps in the system. We've relied on employer benefits to kind of cover most people, and that's been okay, but that's not the reality anymore. People are talking about a recession coming. There's more and more casual work without benefits, people working multiple jobs. We can't be relying on that to ensure people have pharmacare and dental care. We can't just fill the gaps. We need these universal programs in Alberta, regardless of what some of our members of parliament are saying in Parliament Hill.
Right.
I'll leave it with that.
Yeah, I couldn't agree more, Chris. I think that a national pharmacare program we didn't talk about certainly is going to cost to set it up and get it running. But once it's up and running, it's actually going to save money. It's not only going to save money at the federal level, because don't forget, they actually are a healthcare provider as well, right? For the military, for our Indigenous peoples, for a multiple of others. And it will save them money. It will save the provinces money. So, you know, it's a win-win. And then the third win is, of course, for the citizens of the country. So it's a win-win-win. So how they can say no, I don't know. I just don't understand. The provinces are being very myopic, and you know, they just want to pick fights with Ottawa. Meanwhile, the citizens of their provinces and territories are suffering, and shame on them. You know, I heard a rumor, and I know we're being recorded, but I heard a rumor that our Atlantic premiers are very interested in a national public drug plan, a pharmacare plan, and good for them. They can be the leaders on this, because as Karen said in her opening, that Tommy Douglas and Saskatchewan were the first to have a Medicare. So if the Atlantics want to be the leaders on this, I say go for it, and they can shame the other provinces into joining them.
Thanks, Pauline. You know, when you were talking about dental care and pharmacare, it's something that we've been advocating for a long time. And, you know, it is a cost, but, you know, good fiscal management would encourage dental care and pharmacare, because we know when people don't have the ability to take care of their teeth, it's not just their teeth that suffers, it's their overall health. It contributes to pneumonias, to strokes, to heart attacks, to overall inflammation. So, you know, taking care of somebody's teeth and preventing cavities and things like that versus a stay in the ICU because they've had a heart attack or a stroke or something like that seems to be very cost effective. And in addition, when people take their medications properly, they don't end up in emergency as often, and they're not taking up those high cost beds and having those long-term consequences of not being able to manage their healthcare problems properly. So again, for those people who preach fiscal management, this seems like good fiscal management to me.
It sure does. Yep.
Yeah. So I'm going to move on. You know, some of the challenges that we know facing our system is the staffing crisis in every area of healthcare. And we hear a lot about recruitment and retention. And so, Pauline, what are the recommendations that you would like to make that you think would improve both recruitment and retention?
Well, and speaking from a nursing perspective, as well as, you know, you can't take one hat off and put the other one on a lot in these positions that I'm in. But speaking from a nursing perspective, first of all, I'm going to encourage everybody to flip the wording, because we need to retain before we can recruit. So I'm going, you know, you have to have some programs that are focused on keeping the people in the workplace right now that we have. And that might be allowing them to work less at the bedside and have some mentorship roles, which are sorely needed right now as well. So to retain the nurses, to recruit as well, to return people who have recently retired to the workforce, and to give respect and recognition are definitely, you know, the cogs in the wheel to keep people in the healthcare system and working at a job that most of them love. I love my job. I hate my work. I love my work. I hate my job, whatever that saying is. And there's so many out there that are, the statistics are staggering about people considering leaving their jobs, nurses in particular, because of the last few years. Now, having said that, there was a nursing shortage prior to COVID, and the nurses unions across the country for the last 10 years have been saying, there's a crisis coming, there's a crisis coming, there's a crisis coming, and now we're in it. So it's not a surprise to those of us in the system and to those of us who represent the workers in the healthcare system that there's a shortage of workers. It shouldn't be a surprise, but it's a surprise to all the politicians, isn't it? I mean, it's like they have not heard a word we've said over the last 10 years, for goodness sake.
Yes.
You know, it's just mind-boggling. So retain, recruit, return, and respect.
Yes.
And we told Prime Minister Justin Trudeau and the Federal Minister of Health a couple of weeks ago when we were in Ottawa. We met with him, with the two of them, and those were the words we said. And they said they're willing to work with us at the federal level, and then, you know, admitted that the provinces are the problems. They're the problem children, a lot of them, to get any programs going. So it's up to the nurses unions in each of the provinces to apply pressure on their provincial governments to allow the programs, and to work collaboratively with the federal government to look at a solution for this crisis of healthcare workers from coast to coast to coast.
Yeah. And I would think, Pauline, a lot of the respect that you're talking about is, you know, respect for the work that the healthcare workers do, but also taking care of the healthcare workers. We see a mental health crisis within frontline healthcare staff, and you know, some receive presumptive coverage for PTSD, but some do not. And I think that would go a long way in showing the respect for what we have seen the healthcare workers endure over the last couple of years. And Pauline, I see your screen has turned sideways. Just
sorry. Thank you. I'll fix it.
No problem. Okay. So I'll just ask one. Oh, sorry, Chris, did you want to say something?
I was just going to add that, you know, beyond nurses, you know, Karen, AFL, and myself, Friends of Medicare, were with all of the healthcare unions in Alberta yesterday in solidarity together, saying these same things. Staffing is the issue, and these are solutions. And that Minister Copping needs to meet with all of us, QP, HSA, AUP, the nurses together, to talk about a workforce plan for Alberta that does those things, that retains the workers, that shows respect, that recruits people in the system. And so there is that provincial push happening as well, that's saying we're all in this together. It's from any type of job within the healthcare system, this is the issue, and you need to deal with us. And what we're talking about today with the, you know, dental care, pharma care, and other issues, expanding those things would help some of those pressures on the system too, and relieve some of the staffing stress that way.
Yeah, absolutely. I couldn't agree more. So my last question for Pauline.
Sorry.
We don't know. That's okay, Pauline. I'm just going to ask you you did describe this Canadian Health Coalition Health and Hope campaign, but what are you, we can drop a link in the chat, and just wondering how folks can get involved and what the ask is really once people get involved.
So currently we are just recently launched it. So we will have actions that will be available, like write your MP or write your premier, those types of things as we go along. You, if you sign up, you will get a newsletter every Wednesday in English and every Thursday en français. And so we encourage everybody to sign up to receive our newsletter, and it has articles of interest as well as where the Health and Hope campaign is. And of course, if you can throw us a few pennies, dollars, we would be eternally grateful for our eternally grateful for any of your hard-earned money that you would care to share with the Canadian Health Coalition. to help us, seize the moment, seize the day, seize the moment to expand the public health care umbrella, as was Tommy Douglas's vision.
This next question, I think I'm going to address it to both of you because I know you've been doing a lot of work on it. And when we're talking about expanding the Medicare umbrella, it's not just about expanding, it's about protecting what we already have. And I'm wondering if you would please be so kind as to give us some comments and briefly touch on what it means about the privatization of plasma collection and why this is such a threat to safe blood supply and access to plasma. So who would like to begin?
Go ahead, Chris.
Oh, no, I'm first. So I'll start from a provincial context and then mention the Canadian Blood Services. So lots of folks on this webinar probably remember that a few years ago, while the NDP were still in power and Sarah Hoffman was the health minister, that Friends of Medicare and bloodwatch.org did a joint campaign and toured the province, had town calls, delivered boxes and boxes of petitions to the legislature to say no to paid plasma in Alberta, to call for a ban on any sort of form of paid plasma, and to protect the voluntary blood and plasma donation system in the country. And we were successful in getting that legislation. It was passed. It was a good day. Since then, our government changed, and MLA Tanny Yao from Fort McMurray tabled a private member's bill to repeal that ban on pay for plasma. It passed in the legislature, and we've now seen private pay for plasma clinics open in the province, paying people to give their plasma to them. But at the same time, we've seen Canadian Blood Services opened their own plasma centers finally, which was part of their plan to expand local donor collection in Canada, expand our supply of plasma. And we have multiple of those in Alberta, and they were a large success. It showed that if you open voluntary plasma centers in communities, that Canadians would show up and they would donate, and that it was access was the issue, and we needed to do more of that. Unfortunately, Canadian Blood Services has done a total 180 since then. They did not move on to their next phase of opening more centers, and have instead signed a deal for private pay for plasma collection through a company. And what that means, unfortunately, Alberta no longer has the ban, but when we did, Ontario, BC, and Alberta were the three provinces with provincial bans on pay for plasma, the biggest kind of provinces in the country. Quebec has a totally different situation that I won't get into. But those two provinces remaining, Ontario and BC, because of this deal, it actually undermines their local democratically passed legislation, because Canadian Blood Services has an exemption to subcontract, and it can allow pay for plasma into those provinces as well. So even in Alberta, if we wanted to have that fight again, get that law passed, if there's a change in government or something, this Canadian Blood Services deal really undermines our efforts here locally to prevent pay for plasma and to protect the public donation system. But I'm sure Pauline wants to speak more from what's happening nationally.
So the Canadian Health Coalition has contacted wrote a letter, because you don't actually talk to anybody in government these days, it seems like, to the Ministers of Health for Ontario and BC to encourage them to uphold their ban on for-profit plasma collection centers. And BC has said that they would uphold the ban. We haven't seen the letter. They sent it to CBS, which was interesting, Canadian Blood Services. So we haven't seen the letter, and we are asking for a copy of that letter. And so what Chris said was 100% correct, that BC and Ontario still have the legislation that does not allow for-profit collection centers of plasma. And I will just touch a little bit on what the situation in Quebec is, because they have their own kind of Canadian Blood Services system there, and it's called Hema-Quebec. And so what they set out to do when they realized that the plasma collections was way down across Canada and in Quebec in 2015-16, they put their thinking caps on and said, we should be creating plasma collection centers in the public realm. And so from 2015 to now, they've gone from 15% to 30%. So collecting 30% of their own plasma in their own province. So for the people that say it can't be done, we have a perfect example right in Quebec that they put their minds to it. They use public dollars and they went ahead, and it's a big success story, as in other countries, New Zealand, Australia, and others around the world, to set up their own public, not paid, plasma collection centers. So to support the people and that require plasma to live, basically. So back to Canada now, where we talk about the for-profit collection centers. So what they do is pay people to collect their plasma, and then they pool the resources internationally. They sell it on the open market. And this is where I'm going to quote Dr. Michelle Brill-Edwards, who sits on our board and is the plasma guru in collaboration with the bloodwatch.org group, that she says an ounce of plasma products is worth more than an ounce of gold. So these people, this company from Spain, who has a terrible reputation of how they treat people, they are coming to our country, collecting plasma from Canadians and people who live in Canada. And then they say they're going to guarantee a certain percentage of what they collect will be available for Canada. We have our doubts. And then selling it on the open market for profit, obviously, otherwise they wouldn't be interested in doing it, right? And it's not only about the safety of our supply, because we don't know how this company is going to be, producing, refractionating, whatever the word is, the plasma that they collect. We don't know that they're going to be screening for all pathogens, or are they just screening for some pathogens? Are they screening for new pathogens? Like, are they thinking that far ahead? Or is, excuse me, or is their head just all about the profit? So our worry is twofold. It's about the safety of the blood and blood products. Secondly, it's about the sustainability, because we have data, we have evidence that when a for-profit collection center was set up in Saskatchewan, a voluntary donor base went down dramatically in that area. And that's evidence. So this is a threat to our publicly funded plasma collection, and possibly to our blood collection system as well, because it's a two-pronged thing. You can donate only plasma, or you can donate blood. So right now we're talking about plasma, and that's that yellow, we're calling it liquid gold for a reason. It's the yellow part of your blood that people are requiring to keep them alive.
Yeah, thanks for those comments, Pauline. And I would just reiterate that it actually is a threat to supply, because when it can be sold to the highest dollar, and like you said, it is very, very valuable. There's no guarantee that it has to stay in Canada. So we have all these people willing to go and donate, and then we potentially will not have supply for Canada. So it does not secure our supply. That is not a valid argument. And again, it's all about the profit motive. So I see we only have about 20 minutes. So I'm going to ask a few more questions of Chris, but before I do, because we're on the topic, I see Cheryl has posted something in the question and answer, and so also Judy, about the same topic of blood supply. So from Cheryl, she says, we have a public plasma collections in Lethbridge, but our blood donation has ceased. we're told to go to Calgary if we want to donate red blood cells. So, I mean, that's not exactly convenient for people who want to go to donate on their lunch hour or might have been, you know, regular donors. The other comment is from Judy. Is whole blood donation only done through voluntary blood donation? So I'll get Chris to answer that question.
Yeah, so yes to Judy's question currently. Hopefully it'll stay that way. And then to Cheryl's question, I think, and I haven't looked recently, I think what Canadian Blood Services said is they're only doing like mobile clinics to Lethbridge or kind of pop up, like it's not a permanent donation center anymore, but it does raise the issue. It's same as the plasma issue. If we give people access in their community to donate, they will do it. You know, we often see these like frantic ad campaigns from Canadian Blood Services, like right now we need more donors or we're gonna run out, but they're not opening more centers to make it easier for people to donate. Lethbridge is, you know, our third largest city. There should be a donation center. So you know, it's the same issues for blood collection as it is for plasma. We should be providing more public access to do it because we know when we do that, people will donate.
Absolutely. Okay, so I'm going to just move on to a few other topics before we have a few more minutes. Chris, I wanted to talk about harm reduction related to mental health and addiction, because I see that this is another area that should be publicly funded and publicly delivered, and also could reduce costs down the line in our medical system. So I know you've been doing a lot of work on this, and so maybe you could share your insights with us, please.
Yeah, we're very clearly in a drug poisoning crisis in our province and in our country. The number of people dying is very upsetting. It's astronomical. We've set records, and it's not something we should be aiming to set records in. We shouldn't have a province where 4 or 5 people are dying every single day due to an overdose. So we've long supported the need for harm reduction, for consumption services in communities, for programs that will keep people alive. Right now, we have a provincial government who talks about recovery solely, and they say the word recovery over and over and over again very loudly, but you can recover if you're dead. And also our mental health and addiction system isn't serving people, right? It's when people need help, they can't get it. Even with healthcare workers with mental health concerns, those supports aren't there right now. So yes, we need to be expanding our mental health services under Medicare and our addiction treatment services, but we also need to have that harm reduction piece to really keep people alive so that there's some hope in the future. But also, you know, we were talking about the staffing strains and all these strains on the system right now. You know, we're in a situation where I've talked to paramedics in downtown Edmonton, and half of their calls in a shift are to an overdose in the streets. Well, that's a stupid use of ambulances, right? And same with emergency rooms. You talk to doctors or nurses or others in emergency rooms, and the people coming in with an overdose or post-overdose. That's a really dumb way to use our emergency services and emergency departments when we could be providing places that are safe for people to be. So to us, that should all be, you know, both expanding mental health and addictions treatment services, but also those very necessary community level harm reduction services for people need to be a two-pronged approach, which would also help our struggling healthcare system and our staffing issue. And even just the, you know, we talk about retention. And if you're a paramedic and you're going to multiple overdoses a day as part of your work, that's traumatic. That's exhausting. And we're going to lose more and more workers that way. So to us, this is one of our top priorities at Friends of Medicare right now. We have a few top priorities in just dealing with the drug poisoning crisis and the need for harm reduction and improved mental health and addictions in Alberta. You know, this should be all under Medicare. Your mental health should be covered under Medicare's umbrella. So we're going to keep working on that. And you'll probably see some action soon now that we have a new premier and a new minister responsible for some of this. The session's coming up, and I bet you'll see some loud action from community folks again.
Yeah, that's thanks for that update, Chris. And I did read that the new minister responsible for that really believes that abstinence is the way to treat addiction issues. And it harkens back to the day of Nancy Reagan with Just Say No campaigns, and we can see how well that's worked over the years. I mean, people need actual treatment and ability to get better, not just it's not something that you just have to be a stronger person and have more fortitude to go through. They really need treatment and services.
Absolutely.
Well, and if this government is truly worried about finances, some upstream approach would be cost saving. And what it's not rocket science. I mean, you know, the general public gets it. How come our politicians don't? I know it's ideology and I get that, but so, you know, just say no to the upcoming elections and say yes to a different breed of politicians that's going to bring health and hope to our province, right? Like, I don't know. I'm not a politician. Well, I sort of am, but I'm not like a paid politician. But I don't understand. It just boggles my mind as a registered nurse, healthcare professional. I just, yeah, it's like seatbelts. I don't know.
And that's very much like housing's healthcare, harm reduction's healthcare. We have a government who's purposely not funding those things. You know, I've seen Conservative Party emails fundraising on, you know, the NDP wants to bring drugs to your community, is how they talk about harm reduction, because it's a good fundraising tool rather than actually dealing with, you know, people are dying and dealing with that. And just to speak to the federal role for a moment, there was a private members bill put forward to move forward with decriminalization of possession and to have a harm reduction strategy and deal with the drug poisoning crisis from the national level, which was ultimately defeated. And it's extra frustrating. And I will call it out that, you know, Randy Beesnow, who's in the cabinet, voted the day before to allow BC to decriminalize possession, represents downtown Edmonton, and the next day voted against the bill to allow Alberta to do the same thing. And I think we need to call him out. He represents Alberta. He represents some of the communities where people are dying the most, and he should have supported that bill, and he has a role in dealing with this crisis. So it's very frustrating to watch. So I just, you know, if he's your MP, I know he's Pauline's MP, let him know that, you know, decriminalization and harm reduction for BC, but not Alberta, is not on.
Yeah. And the people on the call too.
Yeah.
On the webinar. We're not letting you guys off easy here. We're giving you some homework.
Homework assignments. Yeah, I just want to remind folks that to go ahead and put your questions in the question and answer function. We just have a few more minutes. I just would like, probably Chris, you might be a good person to answer this, talking about the additions of ambulances to the road that are, you know, promised to help our wait times for arriving for ambulances, and just talk about what the reality is in regards to that.
Well, similar to beds, an ambulance is just a truck if there's no paramedic to come with it to you and to treat you and to transport you. And that's, you know, we're seeing promises of beds, of hospital wings, of ambulances, but not dealing with those staffing challenges. And not doing things that would relieve the pressures on the EMS system, like harm reduction, like housing, those pieces. And I noticed Judy had a question there about that they're doing this deliberately, and we agree that, you know, the provincial government right now is purposely letting things break to justify privatizing it. And EMS is one of those examples where, you know, we've been in an EMS crisis for years. It's escalating, you know, red alerts consistently, to the point now there's deep red alerts because they don't know what else to call the fact it's gotten so bad. They made up a new term for a while. But then they set up this committee to look at solutions when solutions have been proposed throughout by the union that includes private EMS companies, right? So it's pretty clear what they're setting up with that committee and that report, and where you could see it going quite soon, that they'll announce, oh, we have to contract out to help with this crisis, rather than doing things like dealing with the fact that there are a huge number of paramedics are on casual contracts, rotating every 90 days without health benefits, without sick days, and burning out, and not giving them real jobs in the system with some job security benefits and a stable schedule. So, you know, there's staffing solutions in front of them that they're ignoring while queuing things up for a privatization agenda based on a report that says, well, I guess we have to, but it's deliberate.
Yeah, they should call them blood red alerts, because really it's the, you know, the life of people that hang in the balance when you're waiting for EMS to arrive and to help stabilize. The other comment I'd say is, you know, we're such an integrated system. Healthcare is such an integrated system that, you know, there are things that happen. For example, ambulances being tied up with paramedics waiting for handover in the hospital. And of course, there's nobody to hand over, you know, somebody to. You can't just drop them off at the door and leave. And so, of course, it needs a full workforce strategy to implement to better wait times for everything. It's not just a matter of looking at it as in such a siloed way, like here's wait times for ambulances, here's wait times for surgery. Like it's interconnected. And I think it's very, you know, they need to take a much broader view about how to deal with all of those issues. Pauline, did you have something to say? I think I interrupted
No,
you.
well, I'm nodding in agreement. I feel like a bit of a bobblehead here, you know, nod. And, you know, whatever the health professional is, whoever the person is working in the healthcare system, you just insert that, right? Insert that role, whether it's, you know, housekeeping, dietary, lab techs, x-ray techs, et cetera, et cetera, et cetera. You just insert that word. They're feeling the burnout. They're feeling with the same day admit day surgery is the unit right next door to the recovery room where I work. They had 5 sick calls today, 5.
Yeah.
And that's because the constant pressure to do more all the time. You know, it's just, it's unbelievable the pressure that the people in the system are under, let alone the system itself. But having said that, privatization is not the way to go. It is not the way to go. It's a myth because, again, profit doesn't care. It doesn't care. And that's, you know, building a whole separate system to somehow miraculously relieve the pressure in the public system is just a myth. It's a lie. You know, just call it out for what it is. And I'll just do a plug right now that we did start a Twitter campaign about, we being the Canadian Health Coalition, about profit doesn't care. So hashtag profit doesn't care. So when we hear about clinics opening and stuff across the country, we put a myth and then the truth and then tag it with profit doesn't care. So follow us on social media, Canadian Health Coalition. And don't forget to follow your provincial and territorial health coalitions as well. Friends Medicare and like the BC Health Coalition, Ontario Health Coalition, just to name a few, are all across the country, every province. And one of the territories has a health coalition, and they're all very active and in their communities and with campaigns that you need to be aware of, because it's now or never, people. It's now or never. We have to not only expand, but protect the Medicare system that we currently have. And as Chris said, and as Karen has said as well, they're chipping and chipping and chipping away at the public system. And listen, nobody can afford to have a separate private for-profit system. Nobody. Maybe just the riches of the world, you know, the 1% of the world, and that's it. And the rest of us will suffer dramatically. And the evidence is there to prove it. When Roy Romano did his cross-country tour about, that's quite a few years ago now, I realize, about how people wanted this Medicare system structured in Canada, there was not one presentation, not one, in any province or territory that said profit is the way to go. Not one.
Thanks, Pauline. That's so true. There's great opportunities right now. There's great threats for our system, but there is great opportunities. And I think, you know, it's through the hard work of activists like you and Chris and all others of our friends in healthcare and broader civil society that really, you know, the system works because of them. And we want to make it stronger. We want to be there. We want healthcare workers to be able to provide care in a timely fashion, and also to be able to take care of themselves so that they are able to be there. Chris, I'm going to wrap up with you just to ask if there's any campaigns that you want to highlight for folks. And I believe there was a link that was in the chat to one of the Friends of Medicare.
Yeah, I think MC shared. We do have a Alberta resident pharmacare campaign on our website email tool that does go to that same minister, Randy Viesno, that I mentioned earlier. He is our only federal cabinet minister, really pushing him, and it also goes to your local MP, to really push that the Liberals need to keep their promise on this agreement on pharmacare. We need to see an act next year that is a single payer universal program. And they need to hear that Albertans want this and support it, because watching the debates and watching, we have 2 New Democrats, 2 Liberals, and a whole bunch of Conservatives representing our province. And if you watch the Conservatives, you would think no one in Alberta wants pharmacare, dental care, we're all fine, and that they shouldn't do it. So they need to hear from Albertans, especially our Liberal representatives, that this is what we want politically. They need to do it. And if they want to get reelected, they need to do it. He won in a 3-way race. And if he wants to get reelected, he needs to do it. So please take a moment, do that action, and really push, because we are in this very hopeful moment where we could, starting next year, start seeing pharmacare roll out in this country. And that's so exciting. So we need to keep up the pressure right now to make it happen.
Thank you so much to Chris and Pauline, and thank you. We know that your time is valuable. All of you who've taken your lunch hour to join us, we really appreciate it. I just want to give a plug for our next Lunch and Learn session, which will be on November 22nd, and it will be about revenue reform. So we hope that you'll join us, and we hope that you have a good rest of the day. Stay safe, everybody, and thank you again.